Hey guys, I hope I am audible. Let me just adjust. Hey everyone, lovely to see you here on a Friday evening. Hope everybody is having a lovely week out there, and even if the week's been a little hard, well, it's the weekend, so let's rejoice. Hi everyone, thank you for being here, and a big welcome to everybody on this Friday evening to yet another episode of the Restore Awards. This is our live series, and all our followers know that we've been doing this as a run up to our wonderful Restore Awards, which are going to be on the 11th of December. Yes, we are going to keep repeating that so that none of you forget, and all our followers, we hope to see each one of you out there. I'm Dr. Bhavna Gautam. I'm a holistic health consultant and emotional well-being coach and a partner with RachnaRestores. Now, for those of you again who are new to our awards and this handle right now, like I said, this is a run-up that we are doing to our awards on the 11th of December, which we are in the second year of our awards. For everybody out there, all our followers know about that, and they know how last year and this year we continue forward the work of celebrating the impactful, the heartfelt, the sensitive work being done by individuals, being done by organizations out there in the field of health, wellness, sustainability, environment care and community support. Yes, that's a huge work that we are looking at, massive impact. Basically any work that has made our lives easier, our lives better, the whole earth basically much better than what it was. So there's no work, big or small. We are not looking at the quantifiability of the work. We are looking at the intention and the effort behind that work. So let me tell you guys, the response has been very overwhelming. Everybody who's been regularly following our handle keeps seeing our lives, keep seeing the little snippets, the little stories by our nominees out there, and I'm sure everybody can vouch for the awesomeness of these nominees. So we definitely have a huge response that's come in this year, and keep following us. Let's see who come out to be the winners of our awards. Now, very quickly, let me just take you through some of our categories. Our categories are the Health Innovator of the Year, somebody who's worked on a process or a system or a design which has impacted well-being and wellness. Then we have the Pioneering Health Social Enterprises. These are enterprises, social enterprises, which have been working in the space of health and wellness and community care. Then we have Sustainable Product. These are lifestyle products. We have Sustainability Vision, which are organizations basically who have sustainability as part of their organization culture. Then we have our Health Warriors Beyond Limits. These are individuals who have not only overcome their own health challenges but are now trying to make an impact to the well-being of those around them. Nothing stopped them. They got up, they fell down, they got up, and they said, we can do much more. Then we have our Healer Beyond Boundaries. These are healers, practitioners, experts who tried to go beyond their scope of work and beyond their scope of duty to create something meaningful in the lives of others. Then we have our Healing Home Chefs. These are geniuses who could combine their skills of cooking with their skills of health and well-being and come up with something innovative. And this year we have our very special category, which is the Pandemic Support Warriors. This is the medical category for the frontline workers who ensured that they not only supported us through the COVID pandemic, but ensured that we got through it in the best possible manner. So these are all the lovely categories out there. So what are we going to talk about today? Today we are talking about a very important aspect of health and well-being. everybody knows about the advances that have happened in healthcare and technology, and how we are now able to measure and monitor physical well-being with so much of precision, right? So today we are going to be talking about this very important pillar, which is called preventive healthcare, which is hugely supported by preventive diagnostics, right? What does this mean? This means basically being able to detect those very small variations that are happening in our bodies by way of, say, blood work, by way of imaging, by way of assessment, and catching them much earlier before they become a huge problem for us. So today, who do I have with me? Our wonderful guest is Dr. Deepti Nariani. She is the head core marketing and key accounts with SRL Diagnostics. And we all know SRL is a trusted, widely acknowledged name in the field of diagnostic care. They are also one of our co-sponsors for the awards, and they have partnered with RachnaRestores on a variety of diagnostic care packages which are available on the RachnaRestores site. Please go there and see. There are wonderful packages at huge discounts that are available to anybody who would want to take advantage of them. Now, coming back to Dr. Deepti, she is a pathologist with about 20 years of clinical experience. That's huge. And besides her clinical expertise, now she is in the field of sales and marketing, right? She is not just such an accomplished professional, but she is also a long distance runner, mother to 2 teens, and a devoted wife. So she's donning a lot of hats, and we're very, very proud to have her as part of our live today. So I'm just going to quickly go and check if Dr. Deepti has joined us. Yes, I see SRL out here. It should be happening right now. Yes. Hi, Dr. Deepti. How are you doing?
Very good, Divya. How are you?
I'm good too, and a big RachnaRestores welcome to you. And first, let me start by saying a huge thank you to you and to the whole SRL team for being such huge supporters in the Restore Awards. And how does it feel now to be out here on a live talking about yourself and your team and your organization?
Wonderful. Thank you for having us. Thank you for having us on the live. And we've been partnering with you earlier also. So
Yes.
forward to be the partners with you on the awards. And you've chosen a very good topic, which is very close to SRL Diagnostics as such. We want
Right.
to encourage people to actually go for preventive, then go for healthcare when they fall sick. So
True. And I think, Dr. Dipti, you would be the right person to explain to all our audiences out here what is the role of, all these yearly checkups and 6 monthly checkups and preventive health checkups that are being pushed now. So people generally tend to believe, nahi, I don't need it. My doctor is pushing me for it. Why don't you enlighten all our audiences as to the essence of and the essential need for having these preventive checkups as your yearly routine?
So, Bhavna, so essentially what I was supposed to say, you've already said it. That's so essentially unfortunately in India, we don't like to spend on our preventive health checks. We have this feeling that if you're feeling all right, if you're feeling well, then there's nothing to be
Why
spent.
do?
Yeah.
Right.
Preventive health check, on a proactive health check, we would rather go to the doctor or to the hospital when we develop a symptom, and then spend enough money on getting ourselves treated. So
Yes.
the purpose behind getting a preventive health check is to know how our body is behaving, to keep a track on the vital parameters of our body, and to immediately start a preventive action in case anything is wrong with the body. So that's what diagnostic is aimed at. And the most vital part of preventive diagnostic is the blood check, because it's the blood which would actually tell us, the blood work would tell us all our organs, how they're behaving. And then eventually then we go for imaging, and then we go to the physician if we find anything abnormal in our reports. So which is why preventive diagnostics, we should get ourselves tested at least once a year, to know how our body is behaving. And if we get any signs that we may not be feeling well, even if it's less than 1 year, go for preventive health check. And understand where if the body, because the body starts giving signals beforehand only, so we need
much before, yes.
Before. So we need to get ourselves tested periodically as and when advised. If we are feeling absolutely all right, at least once a year is mandatory. And there have been cases. An example very close in my family where we thought we were absolutely fine, and then one day our preventive health check told us that we had the parameters showed that we had cancer. So and similarly happens with lifestyle disorders also, that suddenly we get to know that a very recent example I'll give you. SRL had held we celebrated Diabetes Day, and we ran a campaign, India Fights Diabetes, and it was surprising to know that so many of my young colleagues were tested positive. They had high HbA1c levels.
Right.
So just an example to let people know that it's essential to undergo preventive health checks.
Right. And you know what? So I think the message that people probably either mistake or fail to understand is that most lifestyle disorders start showing these small variations in these blood works before they actually become a lifestyle disorder. So you may show, like you said, when you did these tests, they may be pre-diabetic, and an early intervention will stop them from becoming full-blown diabetics. Or an early pre-cancerous diagnosis will prevent them from becoming, a last stage cancer diagnosis, which will be difficult to treat.
Correct. And at a very early age, you take the right preventive measures. You change your lifestyle, and and then does you prevent a full-blown disease to happen?
Absolutely. So, you were very right when you talked about when a lot of your colleagues went in for this test. A lot of them must be young people, right? And nobody assumes that as a young person, why should I get this checkup done? What is the trend? I think you would have some lovely trends to share. What sort of age group should look at health checkups? And earlier I knew the concept. Everybody post 50 when we were just studying in medical college. Everything was post 50. All health checkups, yearly health checkups were post 50.
No, actually,
I don't think it's
no concept of health checkups.
There was no. True.
It has started. It has started following the trend of health checkups. So now, surprised to know that now the parents have become so proactive that, and actually it's the teens. Once in the teens, we should start getting a preventive health checks done.
Yes.
And once a year health check, because again, so I keep on using the word you'll be surprised, because we keep on getting surprising facts from our reports.
Yes, I'm sure.
The surveys that we have done, we were a part of a government. So we were partners with Government of India in a huge nutrition survey, where we found out that obesity was equally a pandemic as malnutrition is in India. And so in well-to-do families, a lot of kids have obesity, and which is not, and that again leads to malnutrition. So so that leads to a lot of nutritional deficiencies, and then leads to bad health later on. So it's a good idea to, when even for a teen, once a year health check should be done.
Fantastic. So everybody out there, health checkups are not limited to the senior citizens of your family. It's for everybody in the family. And I completely agree, because at the Restore community also, as health coaches, we see so many cases of young girls with hormonal disorders, right? Or deficiency of vitamin D. Earlier, again, men don't get vitamin D deficiency is a myth. Today, I see enough number of men with vitamin D deficiencies.
Yeah.
True. So, Dr. Deepti, tell me, how did pandemic, so I understand this is an ongoing work you guys have been doing, SRL has been doing across India. How did the pandemic alter the kind of work that probably SRL was carrying forward, or probably your diagnostic team was carrying forward?
So actually, SRL was, so firstly proud to say that SRL was one of the first labs to be allowed by the government of India, allowed by the all the authorities to start testing RT-PCR. So to facilitate providing RT-PCR facility to everyone in the community, SRL quickly set up more than 20 labs, RT-PCR labs pan India. Within a span of a few months, our RT-PCR labs were available for the community for testing. Our staff were trained within a very short span of time to be able to collect samples 24/7 and provide timely and reliable reports to everyone. Our phlebotomists were there, available to you whenever there was a request, and they ensured actually to be following the WHO guidelines of safety precautions. They would always, so I'll give an example. They would reach a household. Before entering the household, they would wear the PPP, the preventive dress that they were provided with, and then they would enter the household. And before leaving the household, they would remove it and then move out. So they would ensure that the infection stayed at the household only, or whatever. If there was an infection or there was no infection, but they ensured that they didn't carry anything from that household and they didn't carry anything inside the household. So this was a very thing that we followed, but it was very essential for to prevent the spread of the virus. Then our staff, I'll first speak about what SRL did, staff, and because we also form a part of the community. We were the first one, the earliest ones to be vaccinated. Our entire staff, pan India, were vaccinated. So if we were safe, we would keep the community safe. So, and because we were always there in office at work, we even during the times of lockdown.
Yeah, you guys were the front line.
Yeah. So the lab and even the people working at the corporate office to support the lab staff, we were always available in office unless there was a government guideline to stay away from office. So that's how. And then we went. We always provided online reports, but at that time we encouraged people to view their reports online. We provided reports online. Then all our processes were digitalized to offer seamless and contactless reporting to the patients. We followed social distancing norms wherever it was required. So whatever measures were required, we transformed ourselves completely. And also, during COVID times, we actually realized that it was our immunity that prevented us from virus. So by immunity, I don't mean the antibodies. By immunity, I mean our body strength, general well-being. So we encourage our patients, our consumers. We spread awareness about getting yourself tested, getting to know about and it has been proven that people who knew that they already had some predisposing factors, they kept themselves away, they kept themselves safe, and thus they prevented themselves from acquiring the worst symptoms of COVID.
True. And you know what? I think that was one thing that COVID sort of helped in. I think the only thing that COVID helped in was get people to realize how much their own health will contribute to this fight against COVID. So I'm sure as your team out there must also be seeing this trend now where people are taking charge and saying, okay, I want to know what my health status is, rather than being pushed.
Yeah. So immunity. So initially, when in the first wave of COVID, by immunity we mean antibody levels. By immunity we mean the strength of our body, the well-being of ourselves, and to know how because what happened? Firstly, it was a shock for us to know that we were going through a pandemic. So that had already taken a toll on our well-being, that had taken a toll on our mental well-being. So and our lifestyle had gone for a toss. So in 2 to 3 months' time, it was surprising to see how people's health had deteriorated when they actually underwent preventive health checks after the market opened. So COVID has taught us that we need to keep a check on. And actually, so 50% of people went through the worst. 50% of them, they changed themselves. They actually
Yes.
started after themselves, and
Yeah.
it was better for them.
And I'm sure, Dr. Deepti, you will agree that the fight is far from over.
True.
We
And,
need to now sustain this fight for much longer, because now everything is opening up. Now we are stepping out back again.
yeah, and this pandemic has taught us that today it's COVID, tomorrow there may be another virus.
Yes, yes,
So
it could be anything. I mean, we are at stake. We are just out there like sitting ducks when it comes to.
yeah, so it's only a well-being. We can only protect ourselves from getting infected and from being a part of the aftermath of the
Yeah.
infection.
So everybody out there, we are talking to the wonderful Dr. Deepti Nariani from SRL Diagnostics. Dr. Deepti, you being a pathologist, of course, as medicos, we understand the gravity of, when the pandemic hit, the gravity of the situation much, much more in details and in depth. As a pathologist, as somebody who's now even seeing the numbers, okay, because you're the head of a diagnostic lab out there, you're seeing the numbers come in. How were you ensuring that your work and your stressors somehow did not go back home? You're the mother of two teams, you have your husband out there, and you're trying to manage your work and your home. How did that whole thing pan out for you?
So actually, one had to be very strong, because
Yes.
you were being reached out by everyone, by
Yeah.
family, by friends, by neighbors, by everyone. So while you had to maintain
Yeah.
your mental balance, you had to be there to support others. So
Yes.
so essentially, it was, I think, somewhere the exercise, the protocol that I follow, it really
Yes.
helped. Yes, it helped me, and somewhere nutrition also helps. That you take a proper diet and
Yeah.
maintain a fitness regime that helps you keep positive during the stressful times that we went through as medical professionals. So yeah,
Completely agree. And that's why this year we have this special category for the frontline support systems and for the doctors out there, the nursing staff, the allied services who ensured, putting themselves at the line of fire, at risk out there, putting their families also at risk. They
yeah,
ensured that they continued the fight. And I think a huge gratitude to everybody. And like I said, the fight is far from over. I think the best way to support the frontline staff today would be that we mask up, we improve our immunity, and we don't put them at the risk of continuing this war for too long.
correct.
Yeah,
That's because you know um, um, the health workers, they didn't think of
yeah,
anything but
they
to
didn't. Yeah,
be
yeah,
available for them. So yeah, we need to be grateful, and we actually can help them only by preventing the virus to spread.
absolutely, absolutely. Your vaccinations, your mask, the social distancing, it needs to continue further. Now, Dr. Dipti, before I let you go back to the amount of work on your desk, I know there's a lot of work piling up for you. Very quickly, if you could tell us, what does SRL now have in vision, considering they've been through the pandemic? Any change in the vision that they have in terms of diagnostic services that they're planning across? Anything new that they are introducing? How are they going to proceed from now?
No, so our vision continues to be the same, that we want to
Right.
be the most trusted and dynamic diagnostic.
Yes.
And we want to be the leaders. We always have been the
Yeah.
leaders. We want to continue to be the leaders in the diagnostic industry. Leaders by way of ensuring that we create awareness amongst the masses that
Yeah.
look after yourself, look after your family, look after your health. So we have, apart from, so any test you ask for, it's available with SRL. Similarly,
Right.
for preventive packages, we have specially curated preventive packages available. So we have curated them age-wise, we have curated them disease-wise, we have some packages which are meant for only for a certain organ. For example, if you're a diabetic, and you would want to get yourself monitored periodically. So we have
Right.
a vital care, and so before that, we have a care series. So we call it a care series of preventive packages, which are curated as per the needs. So if
Right.
somebody fitness, so we have fitness care packages. If somebody has some issues with one of the organs or has some kind of disease, we have disease specific care packages. So and we keep on modifying them, as and when. So when
Right.
2 years back, the pollution actually hit us badly. The pollution
Yes.
has been hitting us, but it came in a really, really worse
Yeah.
form. So SRL was immediately ready with a pollution care package. So
Okay.
thereby we were providing all the tests which could help us figure out how our chest was and how our immunity.
Reacting. Yes.
So and our packages are a mix of blood tests as well as imaging service,
Images.
imaging tests,
Yes.
which are vital tests for to figure out how our organs or body is behaving. So
Right.
we keep on innovating as and when it is required. We recently we keep on seeing that people complain of, especially during the pandemic. I'll give an example.
Yeah.
During the because of our eating, because of our eating lifestyle, because of constantly sitting and worrying about what would happen, a lot of
Right.
people developed gastric symptoms and
Yes.
gastritis.
Very common.
So, yeah, so SRL was one of the pioneers in starting a panel around gastritis, whereby we could
Okay.
test how whether a person who has these abdominal symptoms has gastritis,
Right. Right.
some other disease. So, and then if this panel was called as gastro panel. So similarly, for allergy, we have for so any requirement which suddenly springs up, my marketing team and my field team, they immediately come up that this is the requirement, and within days SRL is ready with the tests to available to the community.
And I think what helps is having somebody like you with your vast experience from the clinical field, being part of the product field and the marketing field, combining these two together. I think it makes the process so much more faster and easier for, as
Yeah.
SRL to be there. I completely get that. Yeah.
Even the lab doctors are
Yeah.
they keep on meeting with the doctors, and we
Yes.
are in clinical clinicians and try to understand their needs. So all of us, we work together to cater to the most recent needs of the society and of the clinicians.
And everybody out there, having worked with SRL closely, like I told you about these wonderful packages that the RachnaRestores platform now offers through SRL, I can completely vouch for what Dr. Deepti is talking about. That the accessibility, the connect, the care that the team takes. It has been a wonderful experience for us as the platform out there, as well as for our patients out there. It's been a very, very smooth process. So thank you very much for that too. And everybody out there, you can go to www.RachnaRestores.com and check out these wonderful packages which have been curated, like Dr. Deepti said. They have been specifically curated for special needs rather than being very, very generalized. So I completely agree with the part that SRL is being very sensitive and proactive to the needs.
And responsive. So
Exactly, very, very responsive. I completely agree with that. So this has been a wonderful interaction, Dr. Deepti, and a heartfelt gratitude again to your team, to you, to the whole of SRL Diagnostics, not just for the wonderful work you guys have done as the frontline support system, but also for supporting the Restore Awards and helping us get the message out there of prevention, of sustainability, of wellness, going beyond just disease treatment, but looking after yourself while you are well. So this has been really wonderful. A big thank you for that.
our pleasure. Thank you.
I would also quickly like to take this opportunity, guys, to say a big thank you to all our other sponsors who are participating and supporting the Restore Awards. We have Savlon India, we have SRL Diagnostics, the way we said right now, we have Organic India, we have Fiyama, we have Dermafic, we have Radio City with us, and we have our gift partner, which are Himalayan Water, Mount Creations, and Alna Sustainable Living. And of course, no one can forget our venue partners, the lovely ITC hotels. And everybody, 11th of December is the day that we look forward to having all of you. Dr. Deepti, do log in and be part of the awards. You must see the culmination of all the efforts that we are doing with the support of lovely sponsors like yourself. And we have some very esteemed independent jury who are going to be part of the entire the award process. We have Sunita Mohanty of Google Singapore. We have Dr. Taruna Madan, who's the head scientist at ICMR. We have Mr. Subrata Datta, the Group MD of Organic India. We have Mr. Nazeeb Arif, Executive VP of ITC Limited. Ms. Hiru Mirchandani, who's an independent director on the board of some top corporates. We have Ms. Sonalini Matthew, a health journalist, and Mr. Ratan Jalan, who's the MD of Medium Healthcare Consulting. So keep watching, keep looking after yourself. Guys, in some places out there, people are celebrating Thanksgiving. So it's always a good time to say thank you. Thank you to the frontline workers. Thank you to everybody out there supporting the health and the wellness of the community and of Mother Earth. Have a lovely weekend and a big thank you to one and all. Take care. Bye-bye.